Welcome back to Trends and Friends. It's a good rule of thumb to check on your health insurance here and there and make sure you've got the best coverage for you and your family. And today, Jim Schuster from Kemper Health is joining me to talk about some of those options. Jim, thank you so much for being here.
Thank you for having us.
Appreciate you taking the time to kind of talk through some of these health options with us. Now, I know for us, sometimes we don't necessarily think about it. It's just kind of a routine thing. We just go ahead and maybe choose the same options every time. But it's kind of a good time to start thinking about maybe changing it up a little bit. So what are some of the options, or what are some of the things we should start thinking about to know if we've got the right coverage?
Well, there's all kinds of options in the marketplace right now. Obamacare, or the Affordable Care Act, dominates some of that, but there's also options to the Affordable Care Act, and people who don't find success with the Affordable Care Act, there's things we can do. Everything, quite frankly, from sharing ministries to private plans, different types of options. The market's really split into two distinct categories. The people who are under 65, not eligible for Medicare, and then the people who are eligible for Medicare. And at Kemper Health, we try to concentrate in both those areas and provide information on both.
And when someone calls you, what's some of the information you might ask them to kind of get them steered in the right direction?
A lot of it in today's market depends on their potential for special enrollment periods if we're not in the annual enrollment periods.
Okay.
And so much of our work is now done during annual enrollment periods in the Medicare market. That mainly runs from October 15th to December 7th.
Okay.
In the ACA market, it runs from November 1 to various dates beyond that. It's been longer and shorter depending on the year, but there's also a lot of opportunities for enrollment outside of that time into the Christian health share plans, to private plans, and special enrollment periods. So we'd probably quiz them about their current scenario.
Okay.
Have they lost coverage due to a loss of a job or a move, or for whatever reason, are they eligible for a special enrollment period? That'd probably be our first step.
Okay. And what information should they have prepared and ready to go when they talk to you on the phone? Do they need to have a plan, their current plan in front of them, so that you can kind of have an idea of what they've got covered?
It helps. We want to have some indication of what they currently have, because we want to establish if we're going to be able to improve their scenario.
Okay.
And that aids us in approaching it from that fashion. Other things that are important, a lot of health insurance now is built around family size and income even.
Right.
There's that combination can determine whether an individual is eligible for subsidies to help offset some of these expensive premiums. If it's the Medicare market, we want to know if they're just entering the Medicare market, if they're eligible for open enrollment due to that, and again, what coverage they have and what they're used to.
And how should they reach you?
Easiest way is by phone. Our local office is 806-798-0800.
Very good. Thank you so much. I appreciate you being here.
Thank you.
All right. Coming up, we'll have a little bit with Christy and the Latino Lubbock update. That's up next.